Thanks, Cindy, for the great overview of day one. So day two, as Cindy alluded to, will really start looking at some of the different types of innovative methodologies and technologies that can be used for precision nutrition. So my name is Bruce Lee. I'm a professor of health policy management at the City University of New York Graduate School of Public Health and Health Policy. I'm also executive director of the Center for Advanced Technology and Communications in Health which is abbreviated CATCH at the CUNY School of Public Health. So we're going to be looking at different types of methodologies and approaches that have been developed in recent years that can be used potentially for precision nutrition. Of course, this won't be an exhaustive list, but we really wanted to select a sampling of different types of technologies and approaches. So one of the things that we wanted to do in structuring the second day is figure out how are we going to actually organize or categorize these different types of technologies. So what we decided to do is we're going to divide it by different types of scales. So we're going to start off with an overview in terms of the industry landscape in personalized nutrition, and Mariette Abrahams from Kina will be starting off. And then we've decided to organize the different technologies and methodologies by scale, meaning going from sort of the genetic scale to the physiology microbiome scale, to the individual scale, and then to the social ecological scale. And then with each of these, we're going to have 5-minute presentations from each of the speakers to whet everyone's appetite and give everyone a sense of what's being done in the area. And then we're going to have a discussion after the speakers go for each of these sessions. So this will be an opportunity to ask the speakers different questions. So please feel free to put in your questions. We'll try to get to all of them, but of course, time will be limited. So make sure you line up your questions so that we can have a healthy discussion. So basically, to start off, as I mentioned, Mariette is going to start off our day. She is the founder and CEO of Kina, a B2B platform and consultancy that provides access to a curated database of personalized nutrition solutions and a network of domain experts. Dr. Abrahams has been working in the clinical and medical nutrition industry for over 20 years and leverages her combined expertise in nutrition, business, and research to help businesses navigate the personalized nutrition industry, provide market insights, and innovate. She received an MBA from the Open University and a PhD in personalized nutrition from the University of Bradford. So without further ado, I'm happy to turn over the virtual mic to Dr. Abrahams.
Thank you, Bruce. That's a nice introduction. And I have been asked to speak about the evolving industry landscape in personalized nutrition, as Bruce mentioned. Really, I want to take you on a journey of the personalized nutrition industry, mainly over the last decade, because we've seen so many changes, and really provide a context for the other speakers that are following after me to give a great overview of what is currently happening within the industry. As I said, my name is Mariette. I have a background in nutrition, but have since ventured more on the entrepreneurial side. So just for transparency, there's no financial disclosure or conflict of interest. The Kina platform that I will be mentioning is, of course, created and owned by us as well. So where do we start and where are we going in personalized nutrition is really the topic that I would like to cover for the next 17 minutes or so. And really to start off and take you through the journey of the personalized nutrition industry. When I think about personalized nutrition, although it started in kind of 2006, we really think about it from around 2012 when personalized nutrition really became more in its own. So at that time, we really had limited scientific evidence in terms of the impact of personalized nutrition that was beyond medical nutrition, that really focused on prevention itself. There were really only a few niche players within the market. And I look back at our data in 2012, there were about 16 companies in the personalized nutrition industry at that time. And they were really focused at the worried well, who could afford these solutions. Also, we had early adopters that tended to be female, very educated, with high disposable incomes that could afford these solutions. And really, behavior change at that point was seen as kind of an afterthought. It wasn't really incorporated within the solutions at that point. It was more about generating and collecting data and providing personalized advice based on the data that was collected. If we put this on a path, you can see we started in 2012 with a real focus on nutrigenetics and how we could personalize diets based on understanding the makeup of an individual. Then we had the ZV paper published in 2015 from the Weizmann Institute, and we'll also be speaking a bit later, but also the Food for Me paper, which was published in 2015, which really provided the biggest study in consumer acceptance and perspectives in personalized nutrition. By the end of around 2015, there was a systems approach personalized nutrition company that received a big investment and really was focused on demonstrating that personalized nutrition not only provided health outcomes, but also helped to change behavior. Round about 2017, another personalized nutrition company was launched called Habit, and they also provided personalized nutrition advice, received a lot of funding, and also launched in the US market. By 2018, we could really already see that the market is now definitely gathering steam, that consumers were more aware, and that there was more interest in finding personalized nutrition solutions or finding products that could help individuals improve their health and their nutrition and their lifestyle. By 2019, Nestle acquired Persona, which is a personalized nutritional supplement company. We also launched in 2019, which really aimed to connect industry, academia, frontline healthcare professionals, as well as the industry, and to really make sure that the industry focuses on the science-based solutions and that health experts actually have a good input into development of these solutions as well. Unfortunately, by 2019, by the end of that, Aravel actually closed operations and Habit was acquired by Viome, who's also speaking later. And then DSM acquired Ava, which is a digital platform where you can access expert advice from a dietitian via a chat function. Then Bayer acquired Care Of, also another personalized nutrition supplement company, for 225 million. So really the market at this stage was very much focused on personalized supplements and the growth of this area, and then was sparked further then by the COVID pandemic. This pandemic has really increased awareness and heightened interest in amongst consumers about the power of food and also the power of good health. And so I would say the COVID pandemic really pushed forward the personalized nutrition industry, not only in terms of the growth in telehealth, but also smart eating apps, which helps individuals to select foods that's based on their preferences or the taste, for example, or health goals, but also an interest in supplements, which saw a huge growth in that, as well as content. So consumers were more looking for quality content by experts that focus on not only how to improve your health, but how to boost your immune system, how to eat well at home, how to shop better, and also improve your microbiome. By the end of 2020, beginning 2021 of this year, DSM invested again in Hologram Sciences. And here we can already see that there's now another shift, not only in terms of what the industry is providing in terms of solutions, the businesses itself are also shifting in the way that they are offering solutions in terms of not only their business models, but also in terms of partnerships. Then we had the PREDICT study that published their second study earlier this year, which is the basis of the systems biology approach by Zoe. And then Noom, following that, raised 540 million, which really focuses on cognitive behavioral therapy approach for personalized advice, where you can access via a hybrid approach of accessing experts, but also accessing advice via a digital interface. And so we've really seen the shift from very high tech, I would say, from a very genetics focus to now moving more into very actionable and also a behavior focus. So where are we now? Well, really, as I said, the market in 2012 was around 16 companies. And this is kind of how the landscape looks at the moment. So we've counted around 390 companies, 398 companies in the industry at the moment. It's highly fragmented. And of course, it's quite difficult to keep track of the industry, not only in terms of what solutions are being launched, but also how companies are moving within the segments through partnerships and collaborations. So we were approached really by both industry and frontline healthcare professionals to really understand which solutions are on the market, which can be integrated, who is doing what solutions are they offering, which really made us launch our Kina platform, which is the first curated database in personalized nutrition, where we make navigation and understanding the industry very easy. And so with the platform, it's much easier now to search for companies by segment, to understand which technology they are using or incorporating, to find companies, or also search by keyword and find companies, and also see how the companies are creating these strategic partnerships or ecosystems by really increasing their offering and the experience for consumers. So if we look at what the composition is of the market, you can see that really the market has shifted completely from a very much nutrigenetics focus to really across the board, all these different kind of solutions that can provide personalized advice based on different data points. If we look at just on the right-hand column there, we looked at the difference in the composition of the industry between 2014 and 2021. And we can see, we just picked out 4 areas there, but nutritional supplements, that the number of companies within the industry increased by 17%. Between 2014 and 2021, the microbiome number of companies has increased by 80%, dietary preferences has increased by 54%, and devices, the number of devices, and these can be anything from continuous glucose monitors to breathables to dispensers that provide personalized nutritional supplements or beverages, for example. We really see a growth in the different areas, different segments based on not only the dietary preferences, as I say, but also health goals and needs and interests of specific consumers. And this is only expanding. This is only growing, and it doesn't show any signs of stopping whatsoever. And so it's really interesting to note that within the nutrigenetic segment, for example, although it's still growing, it's growing slower. We see that dietary preferences is definitely growing as people are getting more concerned about what they are eating and also what is in their food. So just to summarize there, what we see is this COVID pandemic has increased this awareness in nutrition and health for solutions that help consumers to base their preferences on their diet or their dietary patterns, their health goals, whether it's their taste. And we see values also being increasingly important as a way to personalize their diet. So people want to buy locally, they want to buy organic, they want to reduce their carbon footprint, for example, as well as meeting their health goals. So it's not as clear cut anymore, which also means that the market is so fragmented. Then we see behavior change becoming way more important because the advice that is given needs to be actionable. And so where in the past it was all about, collecting data and, inundating people with data and reports, this is now completely changed to make it more actionable, to help individuals make those small changes. And so we see that from the research that different behavior change techniques work for different individuals, and therefore there's a variety of behavior change techniques incorporated into the new solutions. But of course, what we also see is that behavior change is better if it has a human element. So what we're also seeing now is that more and more companies are adding services to their products. It's not about just sell products. It's also about how can you help people to implement the advice that is actually given to them via the data that was collected. So what we see now is a combination of the human interaction where companies are providing nutritionists on tap, dietitians on tap, or via telehealth service, for example, for individuals to make sense out of the reports or the results or the advice that they have been given. What we also now see is that there's much wider adoption of personalized nutrition, where it was in the past very much female educated, disposable income. We are now seeing the younger generation being much more interested in prevention, disease prevention, but also health optimization. And the older consumers are interested in managing or treating their symptoms as well, and looking at using food to help them to meet their goals. What we also see is, as I mentioned, these strategic partnerships. In the past, it was very much about go very fast, go very big, get the biggest market share, get the most clients. But there was a realization that not everybody can be good at everything. And so what we are seeing now is these smaller companies, medium-sized companies partnering up and really improving this customer experience, providing more value out of the data that's being collected in a one-stop kind of offering. Consumers are definitely demanding more transparency from companies, and they are demanding to see what scientific support is available for these products that are available. What I haven't seen before is recently is consumers are definitely starting to ask more for the actual papers of where the publications are, and they want to have it quickly available. And so there's definitely a shift in the awareness of technology or digital solutions, but also the science that underpins them. But also what we see is that this data is driving hyper-personalization. So in the past, it was very much about let's do the big research, let's definitely fund big trials. But what we're also seeing now is that companies are starting to collect a lot of data that gives insight into what drives consumer behavior. So what is the best interface? How best to interact with consumers? How often to provide advice? What is the best format to provide advice in? And all of that all contributes to how well consumers manage to change their behavior. So it's a lot of insight and learning that can be shared and can be learned from as well in order to develop better products. So what are some of the key trends? Well, we definitely see that scientific advances drive the development of new solutions. And as I mentioned in the graph before, we can see whenever there's a big paper coming out, then we also see the launch of newer startups coming into the marketplace as well. So we'll hear a little bit later from Sarah and the PREDICT study, but we can see that cardiometabolic health is definitely becoming a driver for this new solutions that measure with continuous glucose monitors, for example, and looking at newer business model of having the products as a service rather than just having to buy it continuously. Then the microbiome is also a key area. It has grown, as I mentioned, we're seeing a lot of new launches in this area. But with that, another new study that came out earlier this year in terms of the microbiome and aging is we are seeing more and more focus on healthy aging and longevity coming into the personalized nutrition space as well. And then very interestingly, we're seeing that this hybrid approach of using technology and the human element drives better behavior change. And this was really what the science that we needed, because there was very much a perception that once we have the technology, nutritionists or dietitians can be replaced. But what we've learned now is that actually the technology helps to support frontline practitioners to make them more effective and efficient and help them to communicate better and make sure that they keep track of their consumers, their clients, their patients. And so this hybrid approach is definitely showing that personalized nutrition works, but we can't have it just with technology. We do still need the human element with that as well. Some of the other changes we are seeing is we're seeing new entrants to the market. So it's not just about microbiome or nutrigenetics. We're also seeing now that the pharma industry is becoming more and more interested in this personalized nutrition industry because consumers are demanding it. And so in terms of consumer health, this is an area that is really dipping their toes into personalized nutrition. CaraCare is a German startup that has a digestive symptom tracking app, which is now being recommended by pharmacists once they buy a product that's specifically aimed at IBS symptoms. And so we can see that this concept of a product together with an app as a service to be able to see how you respond is becoming more and more frequent. We also see more wider applications. So in this case, the continuous glucose monitor that is not only for diabetes or pre-diabetes, but is now being marketed as more of a lifestyle or a wellness, or individuals who are very interested in their own individual responses to different foods as well. And we definitely see a demand for this new breed of experts, because now we have rapid scientific advances, we have rapid technological advances, and we have consumers who are taking in their reports or taking in their products or their apps or their data into frontline healthcare practitioners. So practitioners are now in a phase where they need to be able to stay up to date on all different levels in order to personalize the available solutions for the individual to help them to change their behavior. And so this really means that there's a demand for practitioners who can cross the gaps, cross the bridge between all these different areas and stay up to date and be good at their job. And that is where I think the education plays a very important part. But consumers are demanding that their practitioners are up to date and are keeping up to date as well. So where are we going? Well, one of the key areas here is food as medicine. I like to call it food for optimal health. And in terms of personalized nutrition, the newer solutions are starting to close the gap between the food industry and the health industry. And so what we are seeing now is that because people are more interested in what they should eat, what they need to eat, and what they have to eat, is that healthcare is recommending what they should eat, and then the food industry is then providing these food shopping lists or meal plans, as well as education and nutritional support via experts to help them to close that gap and help them to meet their health goals. And this is really a trend which is really growing. We are seeing more and more platforms being launched in this area. It's still very new, but it's definitely the area we are going, and it's definitely a positive move. The other area we are seeing is that retailers are starting to play a much bigger role in health. It was very much needed, especially during COVID. And so we are seeing retailers really taking a proactive role, not only to provide access to affordable and healthy food, but also be a source of education, healthy options for food, in-store guidance, and personalized rewards or personalized discounts, as well as wellness services. And this can be weigh-ins, it can be, measuring blood pressure, cholesterol, glucose. One example here is Hy-Vee, and what they've done is integrated a telehealth platform where dietitians are, at the other end of the technology, and so consumers can really get virtual tours of the store. They can access health programs to improve their heart health, for example. They can get education, or they can even get medical nutrition advice as well. So we're definitely seeing a shift, not only in terms of the number of products that are coming onto the market, it also the types of products and how the market is shifting to really connecting the dots rather than just having separate products that really just serve one type of customer or consumer. And then we have this growth or interest in terms of people and planet. So sustainability is really a growing priority for many consumers. This drive in terms of plant-based eating also means that it has an impact on the types of solutions that are being offered within the marketplace, but also means that even if one company offers one product, they are now starting to offer, the recommendations to meet that demand for those who want to or are considering to start a plant-based diet as well. Also, again, another positive shift. Slowly, but it's happening. And then, of course, we have regulation. And so regulation is really starting to tighten up. And in Europe, especially here, we have now more tighter regulation in terms of which data is collected and how it is stored, but also how it is used. So if the data is collected and then recommendations are made as part of that, then it should be considered a medical device. And so this is an important development because it could help to separate, personalized nutrition as evidence-based, science-based solutions from more of a marketing or wellness lifestyle-based solution. And so this is very important so that we ensure that the companies that develop solutions are really, really grounded in the science and proof that actually their recommendations lead to positive health outcomes. So how do we ensure equitable access? And this is really an important area, mainly because we've seen such a rapid growth within the industry. And as I said, it doesn't show any signs of slowing down. So how do we make sure that the relevant products are benefiting those who need it the most? So we believe that equity needs to be by design. So many companies say, well, it's not our target group, or our price point is higher, but we believe that really every company should have equity by design as within their fabric, and they can really build in different levels of personalization. And nutrition education, food literacy are all different areas where they can be guiding individuals or consumers to credible sources of information, or use the existing algorithms also to provide food-based personalization as well. Whereas the United Nations Sustainable Development Goals are also another way that companies can use as a basis to make sure that the products they design are equitable. Also, it's very important to keep it relevant. And this is really to ensure that the right solutions meet the goals and the needs of the relevant population group. And we definitely see that better collaboration between industry and academia can drive research, because as I mentioned, many of the companies sit with a lot of insights about how consumers are using apps, how they find these tools, how they use them, how often they log in, which data they tend to share. And so there's important knowledge that can be used to drive research, to make sure that we are actually developing solutions that consumers will actually use and that will give us the health outcomes that we are actually looking for, rather than searching for the next shiny toy. And the final one is, we really believe that these solutions that are evidence-based and have proven health outcomes should be reimbursed, especially for those individuals who are motivated to change their behavior, who are looking to change their lifestyle, who are looking at ways to improve their shopping and their cooking, for example. And so there are many ways that we can make sure that the personalized nutrition industry develops these solutions that are equitable and that are accessible as well. So, just in summary, the personalized nutrition market is very dynamic, it's growing rapidly, and it's increasingly tipping towards the mainstream, with scientific advances supporting its merits. However, more should and can be done to conduct more inclusive research and provide equitable access at a time of heightened interest and need. And I hope that that is what you can take away from my presentation. So I thank you for your attention, and I would welcome any questions. Thank you, Bruce.
Well, thank you, Mariette, for that great overview. It really, I think, set the stage for the whole day very well. I shouldn't say whole day because it's 3 hours, but it will be a Zoom day. So I think we have time for one or two quick questions. So one quick question I had was, if you look, so to sort of play devil's advocate, if you look at some other industries that have grown up, within technology, the criticism has been that they've been very focused on particular segments. A lot of businesses coming out of Silicon Valley, tech startups, and of course, eventually becoming tech giants, have continue to focus on particular segments with the cost of equity. And I know you touched upon equity and building partnerships and finding ways to promote that. But how do we avoid a similar situation in personalized nutrition, where it's really focused on particular segments or just particular aspects of personalized nutrition? I'm sorry, precision nutrition, I should say, not personalized nutrition.
Yeah. And I think that's an interesting point, because in the industry, it's very easy, I would say, to spot who's doing the right thing, who's going in the right way. And the people who really have the right mission and really have the goal to help individuals improve their health, they tend to be the sticklers. They tend to be the ones that proactively search out other partners and other companies who are also have the same values. So I think it's about shared values, definitely. I also think that healthcare professionals and the access to healthcare professionals is really, really important, because they understand what the problems are. They understand what is needed on the ground. And so more and more companies are employing and incorporating frontline, not only nutrition professionals, but also behavior change professionals. And that is more of what we need, so that this group is involved from the design and is not involved in getting equity later down the line. We need the design and the conceptualization of these solutions to really be inclusive and to be equitable. And that's where I think so I think we'll still have the Silicon Valley, but consumers are getting smarter. And as I mentioned, they shop by values as well. If they are seeing that this is not science-based and it's not going the right direction, they will vote with their wallets.
Well, thanks. So, unfortunately, we could spend a next hour talking about all the things that you mentioned, but we're short on time and have to move on to the next segment.